The second most common shoulder problem after a rotator cuff is shoulder instability. The shoulder joint is a ball and socket joint similar to the hip, though it is extremely shallow and perhaps unstable. We went to Children's Hospital of Orange County and spoke to physical therapist Mollee Smith. We asked her to give us more information on shoulder instability.
Shoulder instability is when the upper part of your arm comes loose from its attachment to your body, and it can happen traumatically, it can happen partially or completely, and typically when you have a shoulder instability problem, if it happens once, you're very likely to have it happen several times. Shoulder instability is shoulder dislocation.
Why do some children suffer from shoulder instability?
There are a couple different reasons why a child may suffer from shoulder instability. One is they might have an injury or a traumatic injury. Another reason could be that they have laxity. They're just very loose all over, so they might have multi-directional instability leading to shoulder dislocations. And the other reason is they might participate in sports that predispose them to instability. For example, sports that involve a lot of overhead activity like swimming, baseball, your throwing sports, volleyball. It can be very painful. If there is an injury or a traumatic injury, you're more than likely your child is going to complain of pain. A chronic dislocator may not have as severe of pain, but they might have a generalized pain in their shoulder, and that pain might also travel to the back of their shoulder into their scapular region. Other symptoms your child might complain of are a feeling of looseness in their shoulder. They might feel like their shoulder is falling, like their shoulder joint is coming apart. They might also feel like their arm goes weak or dead in certain situations. You have a bundle of nerves that exits your neck and travels down your arm that's in very close proximity to the ball and socket joint. Sometimes with a dislocation, if it goes a certain way, it might put pressure on the nerves, which may cause numbness, tingling, or a neurological weakness down your arm.
What can a parent do for a child who has shoulder instability?
Children heal very well and very quickly if you take away the stimulus that is aggravating. So if it's a repetitive injury, if it happened in sport, you want to rest them completely. And ice is always a good idea. Using over-the-counter anti-inflammatories, that's a good choice if you're comfortable with that. The other thing that can be helpful is supporting the arm, whether putting a sling on or using pillows to support the weight of your arm to take the pressure off so that your arm doesn't have to support its weight, can be very helpful.
If a shoulder doesn't go back by itself, is emergency care necessary?
Doesn't always go back by itself. It may spontaneously relocate. The child may do something and it pops back in. Sometimes you can visibly see if it's out of joint, and you definitely want to call 911. You don't want to put a shoulder back into a joint by yourself. It should be done by a medical professional because of the chance of nerve injury when you relocate. And if it's a child who partially dislocates, it's going to go in and out as you move and as you play. So that in those cases, the child is going to relocate on his or her own. One of the ways that I recommend you get back to your previous level of function is visiting with your physical therapist and getting on a rehab program, one that addresses the impairments that you have. So a lot of times with shoulder instability, you're going to have weakness in certain areas, you'll have tightness in other areas, and you want that physical therapist to address those impairments as they pertain to your sport to allow you to get back to your maximum potential.